Welcome to this Q&A from the Fertility Alliance. Today we are joined by the Deputy Medical Director at CREATE Fertility, Archana, who's going to tell us a bit about preparing for an IVF cycle and the kind of things you might want to think about. I wanted to start by asking you about alcohol because I think people often really worry about that. Is it best to just stop drinking completely?
Yeah. Thank you, Kate. Thank you for the question. And thank you for giving me this opportunity for this Q&A session. It is recommended that when women are pregnant or planning to get pregnant, that they should avoid drinking alcohol completely. This is because this minimizes the risk to the baby because of alcohol to the minimum.
And when people are getting ready for IVF, is it best for them to stop drinking caffeine? There's always a lot of advice about that. Should they cut it out completely, or is it just to reduce caffeine that they should be thinking about?
Yeah. So the impact of caffeine on fertility is complex, and it seems to vary between individuals. So therefore, some studies show some potential negative effects, whereas others don't find any associations. So because we have mixed data available, what I would suggest is if you are trying to conceive, it is probably prudent to minimize the amount of caffeine intake. Some people really enjoy caffeine, and I wouldn't want people getting stressed out for lack of taking a cup of coffee. I think that would be unwise. So as long as we minimize the amount of alcohol, and the NHS states, for example, in pregnancy, you limit your caffeine intake to no more than 200 milligrams per day, which would equate to 2 cups of instant coffee or 1.5 cup of filter coffee, for example. So this becomes more important in pregnancy because there's association of caffeine, high intake of caffeine with miscarriages and low birth weight in babies. So we don't need to go overboard with stopping caffeine completely, but perhaps minimizing will be of benefit during the preparation time.
That's really useful. Thank you. The other thing I wanted to ask you about was smoking, because everyone, I think, is aware that for women trying to conceive and for women who are planning to have IVF treatment, smoking is not a good idea. But what about if your partner smokes? Does that have an impact too?
Absolutely. So the effects are twofold. One is secondary or passive smoking. So when breathing in someone else's cigarette smoke is likely to reduce a woman's chance of getting pregnant. But also there is a link between smoking and poor semen quality. Yeah, although the effect of this on fertility is uncertain, but if the partner is male, because we have to be inclusive, so if the partner is male and we're using fresh semen sample for treatment, then stopping smoking would certainly be helpful to improve the sperm parameters and therefore help improve the fertilization during treatment. Also, stopping smoking will help improve general health as well. Yeah. And I also wanted to clarify this applies to all tobacco products, not just cigarettes, but also vaping, electronic cigarettes. So it applies to all tobacco products.
That's really useful to know because I think people sometimes think that vaping might be the solution, but obviously not. What about supplements? Should people be taking supplements when they're starting an IVF cycle?
Yeah. So the current recommendation is to take 400 micrograms of folic acid. So this is available over the counter. So folic acid and vitamin D are recommended as supplements in the preparatory phase or preconception phase of pregnancy. So it would be useful to take these two whilst you are going through IVF treatment. And this should roughly continue up until sort of 13 weeks into pregnancy. When the BMI is higher, so higher than 30, higher dose of folic acid is recommended to reduce the risk of neural tube defects in a developing fetus, and that will be 5 milligrams. This is only available through prescriptions, so women should speak to their GP or to healthcare professional for a prescription for this 5 milligrams of folic acid if their BMI is higher than 30, or if they are on medications like anti-epileptics, and there are other medications which are high risk. So this is something to be definitely discussed with a healthcare professional.
People sometimes start taking herbal medicines when they're trying to conceive as well. Should you carry on with something like that if you're doing IVF?
I would say any patient who's trying to conceive or having treatment to be aware of what exactly they're taking. Because herbal medications don't really have a formulary and we don't know what exactly the contents are, we always have to bear in mind what effects could it have on a developing baby or a pregnancy. So it's very important to be very cautious about what exactly we are eating and what effects it can have. So it's better to talk to a healthcare professional about this.
People often use other complementary treatments as well. And should you carry on with them? Is it okay to carry on with them when you're having IVF, or should you really talk to your doctor about it?
Yeah. So again, complementary therapies, there are a wide range of them. So some are very simple, like breathing exercises. And aromatherapy probably is not is probably just going to be relaxing. Meditation, for example, is just going to be relaxing. There's no evidence they help, but certainly there's no evidence of harm. So it might be absolutely perfectly fine. But other complementary, wider complementary therapies is better to discuss with a healthcare professional again.
And what about exercise? Can you just carry on as usual? Or if you're doing IVF, is that something you should also discuss, particularly maybe if you're doing quite a lot of exercise?
Hmm. So, generally, exercise is a positive thing. We want us to be mobile and active. It improves your cardiovascular performance and also it keeps your general health and well-being. Having said that, excessive exercise sometimes can be counterproductive. We know that athletes and extreme exercises sometimes have no lack of ovulation or delayed ovulation, and thereby have fertility issues secondary to that. But most patients are not in that category. So, general physical exercise is advised. Whilst doing, depending on what treatment it is, whilst doing IVF treatment, because it involves medications that increase the size of the follicles and thereby the size of the ovaries, often women find it's not comfortable to do exercises. And therefore, we should never push our body if we are not comfortable with it. So, generally, we would say not to have any active physical special exercises during IVF treatment. For men, though, is different. Men don't have this risk of ovarian stimulation or torsion or twisting of the ovaries or any discomfort. So therefore, they can carry on with exercise in moderation. And I don't see any restrictions to that.
Diet is the other really big one. Should people be following when they're about to start IVF some kind of special diet or not?
Yeah. So, uh, you know, the RCOG, the Royal College of Obstetrician Gynecologists, provide guidance on, and they emphasize on the importance of nutrition, yeah, before and during pregnancy. So, consuming a wide variety of food, which is um, includes fruits, vegetables, whole grains, taking lean proteins, reducing amount of fat or saturated fats, especially processed food, reducing this, but increasing healthy fats, yeah, essential fatty acids, to ensure that we are taking all the essential nutrients required for both for ourselves as patients, but also for the developing pregnancy and baby is what is recommended. And it's also important when we're talking about diet, we also have to think about our weight as well. Yeah, so having a healthy weight is very important. There is evidence to say both being underweight and overweight can affect reproductive health and outcomes. So therefore, having a healthy life, which can be achieved with good diet or a balanced diet and exercise, is critical.
There's often a lot of talk about stress, and people worry a lot about stress when they're going through IVF treatment. But we know that going through IVF is really stressful in itself. But do you have any suggestions for people about what they can do to actually try to reduce stress during that time?
Yeah, yeah. So this is very it's a very valid question. IVF does come with stress that is inevitable. because patients are going through a new form of treatment. And we're often talking about healthy women who've never probably had any treatment in the past for any medical conditions. And they're also having to take injections, self-administer them, which can be quite tricky and stressful to do it for the first time. So I would say avoiding stress is not possible, but perhaps managing stress is very important. So some of the practical and more sensible things would be to take your mind off in some ways, if possible. It could be as simple as listening to music or talking to your friends or talking to your partner or having a support group. Or a support network where you feel you're in a safe space that you can talk, or having some, taking a walk, taking break from work again could be important, even if it is for 1 or 2 days off work, going on holiday before you start the medications and the injections. Sometimes mindfulness exercises, meditation, breathing exercises can help. And also it's important for patients to think about how they're going to incorporate the treatment along with work. How are they going to balance it? So being organized and being very clear about what they need to do, and getting all the information they need before they start treatment. So all these things can actually minimize or reduce the stress or manage it better whilst going through treatment.
Thanks. Well, we've certainly find that going to a group often helps, and we do run monthly groups for anyone who wants to come along to one and would find that helpful. The final thing I wanted to ask you, and it's something that people often worry about, is they feel they haven't started whatever lifestyle changes they might be going to make early enough. When should you start thinking in preparation for an IVF cycle? Is it kind of 3 months ahead? Is it longer than that? Or can you just make the changes when you actually start the injections?
Yeah, it's a good question. So lifestyle changes, I would say, make them as early as possible. I don't think there is any cutoff where, okay, before and after. So life is a continuum, and so is health. It's a continuum. So the earlier you make the lifestyle changes, the better. But if the treatment can't wait, and if there is a real need to get on with treatment, then the earlier you realize you have to start treatment, the better. But I think I would encourage all women to think ahead and say, okay, I am preparing in the preparatory time of actually thinking about a pregnancy. That's when I would start introducing healthy lifestyle and affecting those changes, because it'll not only help for conception, but also for general health.
That was absolutely brilliant and really, really helpful. Thank you so much. And this is a Q&A from the Fertility Alliance, which you can find on our YouTube channel, along with lots of other Q&As on different subjects. So thank you.